All right, today we're going to be discussing blood pressure. Blood pressure is assessing the pressure within the circulatory system. There is systolic, which is the top number, and diastolic, which is the bottom number. Systolic assesses the pressure when the heart ejects blood out of the left ventricle, meaning that it's the pressure that is the highest against the artery walls. Diastolic is the pressure when the heart relaxes, specifically the left ventricle relaxes. And that's the pressure on the artery walls when the heart is in a relaxed state. So, first off, we have to look at some of our blood pressure equipment. There's various forms of blood pressure equipment. Here we have, these both are standing sphygmometers, and their pressure gauges are slightly different than what is more traditionally seen, which is the sphygmometer cuff and the gauge right here. With both, or all three, you need a cuff, a sphygmometer dial, and a stethoscope. Okay, the stethoscope will let you hear the beats going through the circulatory system as we pressurize the cuff and depressurize the cuff. Okay, so to perform blood pressure, we take our patient or client, wrap the blood pressure cuff around. You want to make sure that their arm is supinated, and we place the arrow where it says artery so that it's over the brachial artery. Seal the cuff, and then have it so that the dial is facing forward. Okay, so now once we have the cuff tight and the dial showing, we want to make sure that we get our stethoscope positioned properly. So we're going to have our stethoscope placed directly over the cubital space in the elbow. And we're going to leave that right there. Now, when we pressurize, we want to pressurize to approximately 200 millimeters of mercury. Okay? And we slowly release the pressure. And I have my stethoscope on. And what I'm listening for is for the initial beats to begin. You can see the ticker starting to tick right there. The beats are coming in, and then the beats fade away. When the initial beats occur, around 120 for her, that's systolic blood pressure. That's the pressure that is the highest against the arterial walls during ventricular contraction. When the beats go away, that is diastole, when the heart relaxes and when pressure is against the arterial walls during the heart relaxation phase. So systolic over diastole. In her case, it was 120 over 80 approximately, which is average. So she's got good blood pressure. That's blood pressure. Today we're going to be talking about body composition, specifically your lab project, which is skin fold caliper. Skin fold caliper is utilized to determine fat percentage. There's other ways to do it, which is a little bit higher standard. The DEXA, which is the gold standard that determines bone density, lean body mass, and fat, adipose tissue mass. There's also the bod pod and hydrostatic weighing. Your lab is going to be the fat caliper.
Go ahead.
So here are three tools that we utilize to determine fat percentage, and these are three different types of calipers. This is the cheapest on the market, and it is not as good as the others. However, if you're looking to save costs, this is your way to go. This one's older, a little bit more expensive. This one here is better and more accurate than this model right here. However, what we'll be using today is what is most accurate as far as the body fat percentage is concerned with skinfold, and that is the Lang skinfold caliper. However, it is the most expensive out of all three. Okay, so when assessing body fat composition with the skinfold calipers, the gold standard technique is the 7-site. So what we're going to do is we're going to measure skinfold at the chest, the abdomen, the tricep, mid-axillary, subscapularis, suprailiac, and mid-thigh. Okay, when we're doing the chest, we want to make sure that we get a good enough amount of tissue when we pinch. And we release the calipers. We don't want to keep them on there too long. And we take our measurement, that's about a 4, then we release, pinch again, release the caliper, about a 4 again, and we do 3 trials for each site, and a 4 again. All right, when we do abdomen, we want to be just slightly next to the navel, and we're going to do our pinch, same thing, release the calipers, take our measurement, don't forget to release the calipers, release the pinch, pinch again, release the calipers, right about an 11 the first time, 12 the second time, then the last one, and 12 again. So when we're doing mid-thigh, you want to be directly in the midline of the thigh and about in line with the greater trochanter. So that's about right here. The optimal clothing to wear is shorts. Natasha here is wearing some tights, so we're not unable to do fat caliper, but it would be roughly the same. You want your pinch, and then pinch the caliper, and then release. So this goes to show you that having shorts on is the optimal way to take the fat caliper with the skinfold. All right, so when we're doing tricep, same principle. We want to be midline of the tricep, right in the posterior aspect of the upper arm. And you'll notice that I'm doing the same side that I've done every other assessment. When we do our skinfold assessments, you want to stay on the same side of the body that you initially first tested. And then, so same idea with this. We pinch our calipers, release the caliper, get our measurements. Remember to release off, don't pull off. Release the pinch, pinch again, caliper, release the caliper, pinch last, third time, release. And that was roughly the same measurement the whole time through. Okay, when we're doing subscapularis, okay, we have our scapula here, and our subscapularis region is directly underneath the scapula. So we're going to try and grab the tissue on the underside, and this grab isn't going to be vertical as the previous ones were. This one's going to be diagonal. So we're going to pinch here, same principle, release the calipers, get our measurement, release the calipers again, release your pinch, pinch again, release calipers, get your measurement. That was about a 7 that time. And then that was about a 7 that time. All right, suprailiac, this is your ilium right here, and this is the suprailiac region. So when we do the suprailiac body fat percentage caliper assessment, this one as well will be similar to the previous one at a diagonal. And we're going to be right over the ilium. We're going to grab our tissue, release the calipers, get our number, 3 times, remembering to release the calipers each time and not drag off. So the last one is mid-axillary. Mid-axillary for females is sometimes difficult to do. For males, you can kind of get right up into this region right here. For females, we're going to have to go just a little bit lower than her sports bra line. So same principle. We're going to pinch, release the calipers, get our number, pinch, release the calipers, get our number, and then 3 trials, pinch, and get our number. She was roughly a 5 on every one of those. Okay, that sums up skinfold caliper. Okay, you're going to take your number that you get, your 7 sites, and you're going to input it into the Excel spreadsheet that's attached to the link. That'll give you your total body fat percentage. And that completes your skinfold caliper body fat percentage. There's another way that I didn't mention earlier on measuring body composition, and that's utilizing this measuring tool right here, and you measure girth. Okay, you do several measurements around the waist, around the arm, around the thigh, and then there's a formula for that. All of that information is located in your textbook, as well as the lab activity assignment.